We are done with first chapter. Can I come on the second chapter? It will be cakewalk for you. Can I come on the second chapter? Histamine agonist is done. Now you have to do everything opposite. Let's come on histamine antagonist. Can I start histamine antagonist? Everyone, people, please respond. Let's start histamine antagonist, also known as antihistaminic. First, you understand histamine antagonist only are antihistaminic. Okay, but so let's start the second chapter. Histamine antagonist. We are done with histamine agonist, and now I'm starting with histamine antagonist. The same set of headings. Okay, under the same set of headings we will study. So let's come on histamine antagonist. What are histamine antagonist? If I say simply antagonist, okay, antihistaminic, I mean H1 antagonist. If I'm not writing H1, H2, H3, H4, I'm simply saying antihistaminic now. Conventionally, I mean H1 antagonist. H1 antagonist will reverse all these functions. You are getting my point? Please understand it. So this is the nerve or cell. This is the nerve or cell from which histamine is synthesized, and this is the organ on which H1 is present. This is H1. These all are H1 receptors. Okay, these are H1 receptors present on the organ. So normally histamine is synthesized here, stored in the vesicle. When the impulse comes, this will come out and it will bind here. Or if it is a cell, it will be secreted when required. So when histamine come, bind here, this is histamine. Binding on the receptor H1, it will show its action. Whatever is the organ, this organ will show the action, depending what is the organ. Okay, based on the H1 action. Now I am giving a drug, antihistaminic, H1 antihistaminic. So this is my drug, H1 antihistaminic. What does this drug will do? This H1 antihistaminic will simply block the receptor. It will block the H1 receptor. So when the histamine is coming, it cannot bind. Since histamine cannot bind with its receptor, histamine cannot bind because they are blocked. Histamine cannot bind. So whatever was the action, it cannot be produced. Suppose you can say it is a smooth muscle. Suppose this organ is smooth muscle. Okay, maybe lung smooth muscle, intestine smooth muscle, uterus smooth muscle. So when histamine come and bind here, it produce contraction. But now histamine cannot bind. So reverse will happen, that is relaxation. Mind my words very carefully. These drugs, antihistaminics, do not produce relaxation. They are just blocking the action of histamine. That's why reverse is happening. I'm saying these are antagonists. These are not inverse agonist. They have zero intrinsic activity. They are not causing any action. They are just preventing the action of histamine. So here the muscle is relaxing because histamine cannot bind the receptor. The drug is not causing the relaxation. There is a difference between the two. I'm trying to explain you. You are getting my point. That is the mechanism of action. So if I say the word antihistaminic, I mean H1 antagonist. Conventionally, I mean H1. Unless until I'm mentioning H2, H3 separately. If I'm not writing anything, I mean H1. I mean H1 antagonist. If I'm not writing anything. Okay. So H1 antagonist will reverse all this. H2 antagonist will reverse all this, and H3 antagonist will reverse all this. If you know this table well, reading antagonist will be fun for you. How many of you with me? Can I start? So can I start antagonist? Can I start? First of all, we have seen the definition. Now the next thing is classification. So definition, they block histamine receptor. They can block H1, they can block H2, they can block H3, they can block H4. So H1 antihistaminic, H2, H3, H4. But if I'm writing only as antihistaminic, I'm not mentioning H1, H2, H3, H4. Conventionally, I mean H1. I mean to say this. Okay. So classification. Classification, you understood. There are two types of drugs here. Please understand now. First generation and second generation. Okay, I'm talking about conventional. I mean, this is the classification of H1 antagonist. H2, H3, H4 are not included here. Most common we use H1 antagonist only. H2, H3, H4 rarely we use, but most commonly we use H1 antagonist, which are known as conventional antihistaminic. These are H1 antihistaminic. They are of two types. First generation, second generation. What do you mean by first generation and second generation? Listen. Please understand. First generation one, they can cross BBB. You know, we have blood-brain barrier. So the first generation, they all can cross BBB. Once they can cross BBB, they will go and in the brain, they will block H1 receptor. In the brain, H1 was what doing? H1 was producing awakeness. Okay, wakefulness. They will block H1, so wakefulness is not possible and person will show sedation. So sedation. So all of these have a major side effect of sedation. Major side effect of sedation. Okay, that is the first generation. First generation. Sedation is a major side effect. If you give it as a treatment to your patient will say, doctor, after taking the tablet or medicine, I feel sleepy. I cannot work. I cannot drive. I cannot concentrate. Whenever I take the tablet, I feel sleepy. So that is a side effect. Patient don't want the sedation as a side effect. Patient want an active life. Suppose I'm a doctor. I'm prescribing a drug to my patient. My patient is taking the drug for any disease. Okay. And after that, patient is feeling sleepy. Okay, so it is a side effect. Sedation is a major side effect of first generation. So later on, we discovered newer antihistaminic. These are also H1 antihistaminic. These are also H1 antihistaminic. They are blocking H1 receptor. Okay, but the point is that they cannot cross BBB. The second generation cannot cross BBB because they get ionized. Ions cannot cross BBB. I told you in general pharmacology. Okay, ions cannot. The whole drug can cross. Okay, unionized form. But the second generation are the one they get ionized. Once they get ionized, they cannot cross BBB. As soon as the patient take, it goes in the blood. In the blood, it get ionized. So it cannot cross BBB. It cannot cross BBB. It cannot block the H1 receptor in the brain. So they do not produce sedation. Even after taking the tablet, my patient is awake. Okay, so here sedation is not there. Got it? So which one you will prefer for your patient? Which patients prefer? Patient prefer these drugs. Patient say, give me, no. Suppose we are having a runny nose. Okay, or cough. So we give cetirizine is the most common drug we give. No, cetirizine. So cetirizine is producing less sedation, although it's not completely free. It is less. But if you give, phenaramin, diphenhydramine, patient feels so sleepy after taking these tablets or medicines or syrups, these compounds. So here, the major difference between there are two differences. The major difference between H1, first generation and second generation. These are first generation, these are second generation. The major difference, they can cross BBB, okay, and that's why they produce sedation as a side effect. They cannot cross BBB, the second generation. That's why here sedation is not a side effect. They are free of sedation. Sedation is not a side effect, and patient is awakeful even after taking the medicine. How many of you got it? How many of you got it? One more difference is there. First, you understood this difference. So I am talking about antihistaminic. I started a chapter antihistaminic. So there are 4 types of antihistaminic: H1, H2, H3 and H4. Okay, I am teaching you H1 first in detail. H2, H3, H4, one line I will tell you in the end. Don't worry. This I will tell you in the end. Only one line you have to learn. This you don't have to go in detail. Okay, you have to learn H1. That is conventional antihistaminic. If I say the word antihistaminic, I mean H1 only. H1 antihistaminic are most commonly used. So this is the classification of H1 antihistaminic. They are divided into 2 classes, first generation and second generation. One difference between them: first generation can cross BBB, so produce sedation. Second generation cannot cross BBB, so cannot produce sedation. Okay, I will read the drugs. One more difference you understand between them. You know this table. See quietly. What is this table? How many of you have attended my ANS class? How many of you have watched my ANS class or attended it? Anyone? Huh? So in ANS, I told you this is a table for muscarinic. This is a table for histaminic. In the same way, we are having a receptor table for the muscarinic receptor. This is M1, M2, M3. If you have attended my session, you may be knowing this table very well. Okay. So the first generation antihistaminic block these. Of course, they are supposed to block these because they are H1 blocker. The first generation. Okay. But they are non-specific. The first generation, mind my words carefully. Okay, open your ear and brain. Listen. The first generation antihistaminic block H1 receptor, obviously. But along with that, they block all muscarinic also. They are anti-muscarinic also, the first generation. They shouldn't block muscarinic, no. They should block only H1. They should be selective. But along with blocking H1, they are blocking all 3 muscarinic also, the first generation. But the second generation block only H1. They don't block muscarinic receptor. That is the second difference between them. So the first generation, they are anti-muscarinic also. They block muscarinic receptor or anticholinergic also. But the second generation, they don't have anti-muscarinic. They block only H1. They don't block M1, M2, M3. Got it? Got it? Yes, Kanu, absolutely right. So what are the differences between first generation and second generation? Antihistaminic. Both of them are blocking H1. I'm talking about H1 antagonist. H1 antagonist. They also block H1 receptor. They also block H1 receptor. What are the major differences between them? First generation can cross BBB. Second generation do not cross BBB. Since first generation cross BBB, they produce sedation. Second generation do not cross BBB. That's why they produce minimal or no sedation. Okay. Along with blocking H1, this also block H1, this also block H1. But this block M1, M2, M3 also. That is, they show anticholinergic or anti-muscarinic action. But they do not block M1, M2, M3. They block only H1. So they don't show cholinergic or anti-muscarinic action. Okay. They show anti-emetic action also because of blocking M1. They show anti-emetic. Since they don't block M1, so they don't show anti-emetic. These are cheap. These are little bit expensive because patient nowadays want this. My patient want that after taking tablet, I shouldn't sleep. I should be active only. So that's why these are relatively expensive. People respond now, got it or didn't got it. So that is the classification. Now I will read the drugs for you. So first generation and second generation. First of all, you understand I am teaching you antihistaminic. So I am teaching you H1 antihistaminic. The conventional antihistaminic are H1 antagonist. These are first generation, these are second generation. First generation produce sedation. Okay, second generation do not produce sedation. Based on the sedation, first generation is further divided into three categories: highly sedative, moderately sedative, and mildly sedative. Highly sedative completely cross BBB, produce too much sedation. After taking the tablet, patients sleep like anything. Okay, moderately is moderate, and mildly sedative is not very sedative. So you have to learn the name of the drugs. Highly sedative may learn four drugs: diphenhydramine, dimenhydrinate, okay, promethazine, and hydrogen. These are the learn both diphenhydramine and dimenhydrinate. Okay, promethazine and hydrogen. These are the four drugs which are highly sedative. Okay, moderately may phenyramine, you can see cyproheptadine, okay, maclozin, and you can see cinnarazine. Maclozin, cinnarazine, cyproheptadine, and phenyramine. These are the four moderately. And minimally may you can read the names. The most important here is chlorphenyramine. Here phenyramine, here chlorphenyramine, the chlor derivative of that. So that is the mildly sedative. But you have to learn all the names in the second generation, which are important. All the names in the second generation are important. Fexofenadine, laurentidine, deslorentidine. It is the des derivative. Laurentidine, deslorentidine. Cetirizine, levocetirizine. Cetirizine, levocetirizine. Azelastine, mesolastin, abestin. Okay, you have to learn. Okay, these are the second generation. People got it or didn't got it? Kanu, Ayushman, Akshara, Anoop. Yes, can we go ahead? Okay, so I'm having certain polls based on the classification. If you learn the classification, you will be able to solve it. So first question is in front of you. Read the question, tell me the answer. Read the question and tell me the answer. Which of the following is not a second generation antihistaminic? You have learned the classification. You tell me which of the following is not a second: cetirizine, cinnarazine, laurentidine, or fexofenadine. Which is not coming in second generation? Which of the following is first generation? I mean, they want to ask. I know I don't know why most of you are wrong. Few of you are right. Correct answer here is B. Divya, Black, and Ankit are first to answer correct. Correct answer is cinnarazine. You can see this one is coming in the first generation. The remaining all are coming in the second generation. Cetirizine is there in the second generation. Laurentidine is there in the second generation. And fexofenadine is also there in the second generation. Why you people are wrong now? You have to learn these. You have to learn these classification. Okay. Okay. But you have to learn it, Kanu. The next question. Which of the following is H1 blocker? This is H1. Which of the following H1 blocker have highest anticholinergic activity? I am launching the poll. It's an indirect question. They want to ask you which of the following antihistaminic, along with antihistaminic, they are having anticholinergic activity also. So basically they want to ask which of the following is first generation. Indirect question of asking that. So first generation have anticholinergic activity. Second generation don't have anticholinergic. So which of the following is first generation? Only one of them is first generation. Which one? Yes. Now this time most of you are right. Absolutely right. Divya, Somi, and Merab are first to answer. Yes. So correct answer here is chlorphenyramine. You can see here. Chlorphenyramine is coming here. Okay. Chlorphenyramine here. It is mildly sedative, but all the sedative. The remaining three are second generation. Cetirizine is coming in the second generation. Fexofenadine is second generation. And you can see estimizole is also coming in the second generation. Okay, yes. So can I start with the mechanism of action? We have seen the definition. We have seen the classification. Can I come on mechanism of action? Can we start? Let's start mechanism of action. I already told you, these drugs are competitive antagonist at H1 receptor. They block H1 receptor. So histamine cannot bind with the H1 receptor. Since histamine cannot bind with H1 receptor, histamine cannot show its action and reverse will happen. It is not due to the drug, but since histamine cannot bind with its receptor, so it cannot show its action. So whatever is the action, reverse of that is happening. So same story is shown to you. You can see these are the receptors. You can see this is histamine. This purple color triangles, these are histamine. When histamine is coming and binding, some action is there. And you can see these yellow are the drugs. Antihistaminic. They are blocking the receptor. Since they block the receptor, the histamine cannot come and bind, cannot show its action. So we are done with definition, classification, and mechanism of action. What is definition? These are the drugs that block H1, H2, H3, H4. But most common among them is H1, which we call conventional antihistaminic. Okay, classification wise, we divide them into two categories: first generation, second generation. First generation cross BBB, sedation. Second generation do not cross BBB, no sedation. First generation, along with blocking H1, they block M1, M2, M3 also, so that's why anticholinergic. But second generation, they block only H1. They don't block M1, M2, M3. So they don't have anticholinergic activity. Okay, now here first generation, we divide them into three: highly sedative, moderately sedative, less sedative. And second generation, you have to learn the list. So please learn the list. Now after that, the most important is pharmacological action. The good pharmacological action will be taken as uses. The bad among them will be taken as adverse effect. So most important is pharmacological actions. But pharmacological action I will divide in two components: antihistaminic action and anti-muscarinic. Because along with blocking H1, they block M1, M2, M3 also. The first generation. Second generation block only H1. But first generation, along with blocking H1, they are blocking. So H1 is blocked by both first generation as well as second generation. Of course, they all are antihistaminic. But anticholinergic is only first generation, not for second generation. So these are the action of first and second generation both. But these are the action of only first generation, not second generation. I'm trying hard. Okay. So coming on antihistaminic effects. Let's start antihistaminic effects first. Let me enumerate. So we will just do the reverse now. What does histamine do on the smooth muscle? Histamine causes contraction of the smooth muscle. Now antihistaminic will block this H1 receptor on the smooth muscle. So smooth muscle cannot contract and it will produce relaxation. So here it is opposite. Bronchoconstriction is blocked. So these drugs are producing bronchodilation. And intestinal contraction are also blocked. So they are producing intestinal relaxation. So here also relaxation. Here also relaxation. There it was contraction. Histamine was producing contraction. So antihistaminics are producing relaxation. Broncho relaxation and GIT relaxation. Since broncho relaxation, we can use these drugs in asthma as a treatment. Okay. And since GIT relaxation, we can use these drugs in cramps as a treatment. I hope you are getting it. Okay. So here the action was relaxation. On smooth muscle, the action was relaxation. Broncho relaxation, GIT relaxation. Okay. Coming on blood vessels. You will tell me what will happen on blood vessel. You tell me what will happen on blood vessel. Yes. So blood vessel, this is also blocked. This is also blocked. H2 is not blocked. I am talking about H1 antihistaminic. I have not taken H2 antihistaminic. I have taken H1 antihistaminic. So H1 was producing triple response. So here triple response will be blocked. Okay. So suppose I am giving myself intradermal injection of H1 agonist. So I will have triple response. But suppose first I am giving an injection of antihistaminic, H1 antihistaminic, and then I am giving the injection of H1 agonist. So triple response is abolished. So it proves that triple response is due to H1 only. Okay, it is proving. Because first, if I am giving H1 antihistaminic and then I am trying to produce the triple response is abolished. So here triple response will be abolished and fall in BP produced by low dose of histamine is also blocked. Okay, so everything will be reversed here. Wherever it was vasodilatation, it will cause vasoconstriction, and wherever it was vasoconstriction, it will produce vasodilatation. Everything will reverse. Coming on the next one, adrenal medulla. In adrenal medulla, here the release of adrenal medulla in response to histamine is also abolished. Here adrenaline will not released. Brain, most important is brain. What histamine was producing in the brain? Wakefulness. What antihistaminic will produce? Sedation. Okay, it will produce sedation. What histamine was produced in the brain? Loss of appetite. What antihistaminic will do? Stimulation of appetite. Both will reverse. So what histamine do and what H1 antihistaminic will do? Antihistaminic. Okay, this is histamine agonist and this is histamine antagonist. So on brain, this produces wakefulness. This produces sedation. This produces loss of appetite. And this produces stimulation of appetite. I guess it's crystal clear. Okay, you can understand. Because here the drug is blocking the receptors. So wakefulness do not happen, so sedation happen. Loss of appetite do not happen, so increase in appetite happen. People respond. Got it? That is the action on the brain. Allergy, histamine was producing allergy. So antihistaminic are used as a anti-allergic drugs. Okay, they can be used as a anti-allergic drugs. Got it? So these were the histamine. These were the histamine action. Now coming on anti-muscarinic action. These were the antihistaminic action. Anti-muscarinic, you know this table well. I guess you know. If you know this table, then only you can understand if you have watched my recording of ANS, right? Okay, Kanu, there is no solid thing on the BP. Both the things will reverse. The vasodilator as well as vasoconstrictor action, both will reverse. Now it depends whether we are talking about small blood vessel or large blood vessel. On small blood vessel, what was the action? Which action was prominent? On large blood vessel, which action was prominent? The summary is that whatever the action was histamine, it will reverse here. You have to just learn that. Okay, come. So coming on anti-muscarinic action. In anti-muscarinic action, what does acetylcholine does on the gland? On the glands, M3 receptors are present. Via M3 receptors, acetylcholine increases the secretion. Okay, and H1 antihistaminic are blocking M3 receptors. Since the M3 receptors are blocked, secretion will reduce. So decrease secretion, dryness of the mouth. They produce dryness of the mouth. Okay, what does acetylcholine produce on eye? On eye, acetylcholine produce mydriasis. Okay, it is producing meiosis. It is producing meiosis here. Okay, acetylcholine produces meiosis. This one, our drug H1 antihistaminic, it is blocking M3 receptor. So no meiosis. So opposite of meiosis is passive mydriasis. So it will produce passive mydriasis and leading to blurring of vision. Okay, what does acetylcholine do on the urinary bladder? It causes contraction of the bladder and relaxation of the sphincter. Here reverse will happen. Okay, it is blocking the entry. So relaxation of the bladder and contraction of the sphincter. So urinary retention will happen. Okay, so all the properties I told you, an anticholinergic will happen here. Dryness of the mouth, blurring of the vision, urinary retention. Okay, one more thing in the CNS. What happens in CNS? What acetylcholine produces in the CNS? In the CNS, acetylcholine produces vomiting. The vomiting center stimulated. Here, these drugs block the vomiting center. So it is producing anti-motion sickness. We use these drugs as an anti-motion sickness. Okay, to reduce the tremors in Parkinsonism. So anti-motion sickness, anti-tremor in Parkinsonism. Got it? Yes or no? So let me help you in revision. Revision of the actions. Can we revise actions quickly, people? So we will come on the uses and adverse effect. Come. I'm teaching you antihistaminic. So this is the table of antihistaminic. In antihistaminic, we have to follow two tables because antihistaminic, H1 antihistaminic, the first generation reverse all this. Second generation also reverse all this. But along with this, the first generation one reverse these also. Okay, reverse these also. That is the summary. Okay, now reverse each of them. So on smooth muscle, normally histamine produces contraction, but these drugs produces relaxation. First generation as well as second generation. Okay, blood vessel, everything will reverse. Vasoconstriction will become dilatation, dilatation will become constriction. Nerve endings, normally these were producing itching. So here no itching will be there. Okay, adrenal medulla, normally catecholamine was secreted. Here no secretion of adrenaline or catecholamine. Brain, normally it was wakefulness and loss of appetite. Here it will be sedation and increase appetite. Histamine was producing allergy. So these are producing anti-allergy. These are causing anti-allergy effects. Okay. So these are the effects on H1. We don't have to see H2 and H3 because currently I'm teaching you conventional antihistaminic. H2 and H3 separately I will give you. Okay. Along with this, anti-muscarinic side effects you have to see. So anti-muscarinic side effects, urine retention, decreased secretion, so dryness of the mouth, mydriasis, so blurring of vision. Okay, anti-motion sickness and anti-Parkinsonism. These two are good properties, remaining are bad. I hope you got it. Okay, so among them, this is the another classification. You can see anticholinergic effects are present highest in which one? So the one which are first generation, they are only having the highest, or maybe we have divided which one is having high and which one is having low anticholinergic effect. This is not based on sedation. One classification I told you based on sedation. This classification is based on the anticholinergic activity. So along with blocking H1, how many of them block M1, M2, M3 more intensely? Okay, and these are the second generation. Second generation don't block M1, M2, M3. So here the anticholinergic action is absent. I hope you are getting it. Antitussive means for cough, but this is not main action for coughing. Tussive means cough. Antitussive means uh, decrease cough, okay, or depress cough. So sometime in the brain they depress the cough center also. So that is the thing. So can we start the uses and adverse effect? We will mark the uses and adverse effect in these tables only. So we are done with mechanism of action. In the mechanism of action, they reverse H1 action, but along with reversing H1 action, they reverse M1, M2, M3 actions also. So that was the summary. Okay. Can we continue? Let's come on the uses and adverse effect. Let's come on the uses first. Okay, let's start the uses. So uses, first I will tell you the uses of H1 antagonist. There are 9 uses and one uses of H2, H3 and H4 antagonist also. Okay, first let me finish H1 antagonist. Okay, we will mark the use here. The first use is allergic disorder. Okay, histamine produce allergy. So antihistaminic will be given as a treatment for allergy. So they produce anti-allergy because the allergy is produced by histamine. Okay, so H1 antihistaminic block the H1 receptor and they produce as an anti-allergic effect. Now please mind it. I don't know how to explain. I told you allergy in the uses of agonist also and antagonist also. Here I am teaching you antagonist. In the antagonist I am teaching you the use as an allergic disorder. If you remember the agonist right now I taught you, they are also in the uses, 4 uses, 2 therapeutic, 2 diagnostic. So in the therapeutic, there also I told you allergy. Now you may be thinking, ma'am, why the agonist, antagonist, both can be given in allergy? The treatment of allergy is antagonist only. Okay, agonists are not used to treat allergy, just to make the patient desensitize. So we are giving small doses to desensitize it. You are getting my point? So agonists are used to desensitize the patient. Antagonists are used to treat the allergy. Okay, got it? Okay, maybe another half an hour, Akshara. I will continue this and I will finish with serotonin. I will start tomorrow. Maybe another half an hour. It will continue. Okay. So coming on allergic disorders. The first use is allergic. How many of you got it? So histamine produces allergy. So antihistaminic are used as anti-allergy. Everyone can understand. Everyone can understand. So it can be used in allergy in many allergic disorders. Like it can be used in itching, urticaria, seasonal hay fever, allergic conjunctivitis, drug allergies, insect bite allergy, IV poisoning allergy. In all of them, it will produce symptomatic relief. The antihistaminic. Okay. But it is of no use in asthma. You will say, ma'am, why? Asthma is also allergy, no? Why it is not useful in asthma? Asthma is also type 1 hypersensitivity reaction. In asthma, the symptoms are due to leukotriene. Main symptoms are due to leukotriene, not due to histamine. So giving antihistaminic will not give much relief. Giving anti-leukotriene will give much relief. You are getting my point. So in asthma, antihistaminic are of not much use. Got it? So that is allergy. The first use is allergy. Second use on the afferent nerve endings. Histamine produces itching. So antihistaminic reduces itching. Common sense. What does histamine do? Histamine produces itching. I already told you. It produces, so if someone give an injection of histamine, it produces itch. Okay, so if someone already have a disease of itch, give antihistaminic. Antihistaminic. So antihistaminic are given. They block the H1 receptors on the nerve ending. Can you see the H1 receptors on the nerve ending? These are blocked. So histamine cannot bind with these receptors, cannot produce itching. It will reduce itching. So it is used as pruritis. Pruritis means for itching. Itch as a disease. Itch as a disease. You are getting my point? Okay. So first use I told you as anti-allergy. Second use I told you itching. In itching we are giving antihistaminic. First in allergy we are giving antihistaminic because they produce anti-allergy. In itching we are giving antihistaminic because they reduce itch. They block the H1 receptors and they reduce the itch on sensory nerve endings. The remaining 7 more uses are there. They are based on the brain. They are based on the action of the brain. Can I come on the action of the brain? There are 7 more. Total 9 uses are there. One is allergy, one is itch. 7 more uses are based on the action on the brain. One by one we will take. So first action is sedation and hypnotic. Okay, antihistaminic block H1 receptor in the brain. So it produces sedation. So suppose it is a person who is unable to sleep. Suppose it is a person who is having insomnia, trouble in sleeping. Give antihistaminic, H1 antihistaminic. So person will feel sleepy. So we can use it as a sedative, as a hypnotic, That was first use based on the brain. Okay, there are 7 uses. The second use based on the brain is appetite stimulating effect. Okay, histamine have appetite depressing effect. This is due to histamine. This effect is due to histamine. Give antihistaminic, person will be like this. Okay, so because antihistaminic will block the H1 receptor in the brain, which is producing appetite suppression. So antihistaminic will stimulate the appetite. So antihistaminics are used as a appetite stimulant. Most common antihistaminic we use for appetite stimulant is cyproheptadine. So someone is complaining, doctor, I'm not feeling hungry nowadays. I'm feeling very less hunger, unable to eat food. Okay, looking at the food, I'm not having a good feeling. So give cyproheptadine syrup for some days. Person will feel really hungry. The diet will increase, the hunger will increase. So appetite stimulating effect is there. Okay. So based on the brain, first I told you in insomnia we give. Okay, the person is having insomnia, give it, person will feel sedation. Okay, as a sedative we give. Second, the person who is not feeling hungry. Okay, so we can give this to increase the appetite. The third use based on the brain. Is motion sickness. What is motion sickness, by the way? This is motion sickness. What is motion sickness? So while someone is traveling, okay, in a car or in a bus, so person feel nausea, vomiting. That is motion sickness. I guess everyone know why it happens. First you understand the mechanism, then only you can understand the treatment. Why motion? So whenever the motion occur, so we all have ears. Inside the ears we are having internal ear. Okay, this is the internal ear, suppose, of this person. This is the internal ear. In the internal ear we are having 3 semicircular canals. 1, 2, 3, which is having endolymph in it. So whenever the person is moving and speed breakers are coming, suppose, okay, so when the speed breakers are coming, so endolymph in the internal ear, due to the speed breaker, due to the movement like this, the endolymph move here and there. Okay, since the endolymph move here and there, it is the endolymph. You can see these are the 3 semicircular canals. Appreciate. Okay, so in each semicircular canal, appreciate it is having endolymph. You can see this is the endolymph. So here hairs are there, small. So when endolymph move here and there, suppose I'm moving my head here, so the hairs will move that side. Suppose I'm moving my head here, so hairs will move that side based on the flow of the endolymph, based on my movement. Okay, so these hairs will move like that, and that will give the signal. See, from here the signal is going to the brain, the vomiting center. So signal goes to the brain, to the vomiting center here in the cerebellum, and here H1 and M1 receptors are present. Okay, and that produces vomiting. Okay, suppose this person is having this problem and this girl is coming to me that, doctor, I'm having motion sickness. Whenever I travel, I feel vomiting, I feel nauseatic, but the journey is unavoidable. Tomorrow or today I have to leave and I have to travel a road journey and it's unavoidable. I cannot avoid it. So give me something prophylactic so while traveling I don't feel nausea. So this person want a prevention of motion sickness. So can I give antihistaminic and anti-muscarinic? Can I give a drug that block H1 and M1 in the cerebellum? So even here the motion is occurring. So signal is going, but that signal is not reaching in the cerebellum because it is already blocked. So person will not have nausea. I tried, people. Appreciate it. Got it? So basically we are blocking the H1 and M1 receptors in the cerebellum by giving antihistaminic and antimuscarinic. But don't give 2 different drugs. Okay, give H1 antihistaminic only, because H1 antihistaminic are the drug that block H1. But non-specifically, they block M1 also. So by giving H1 antihistaminic, both purpose will be solved. So we are blocking H1 as well as M1 in the cerebellum. So motion sickness can be prevented. How many of you got it? Respond. So why does motion sickness occur? Whenever there is motion in the vestibular apparatus in the cerebellum, we are having M1 and H1 receptor. That produces vomiting. So we are giving antihistaminic. Antihistaminic will block the M and H1 both receptor and produces anti-motion sickness. People say, got it or didn't got it? I'm asking again and again, kindly say. If didn't got it, kindly let me know so I can repeat it. Okay, so which drugs we use for prevention? Usually we use promethazine, diphenhydramine, dimenhydrinate, cyclizine. These all drugs 1 hour before the start of the journey. Okay, promethazine can be used also. It is used for the motion sickness, but along with motion sickness, it is used in morning sickness also. Morning sickness is the vomiting during pregnancy. Here also the same mechanism occur. Okay, so morning sickness or drug induced vomiting or post-op vomiting or radiation induced vomiting, any kind of vomiting, we can use promethazine, but the remaining one are used only in motion sickness, not others. So that was one of the use. So one of the use in the brain is in insomnia. One of the use in the brain is to stimulate the appetite in the person who don't feel hunger. One of the use in the brain is to prevent motion sickness. Coming on the fourth use in the brain. How many of you experience this common cold? Most of us. Okay, many people have common cold and we have experienced it multiple times. So what happens during common cold? We have runny nose. Okay, what we take in the treatment? In the treatment, if we are taking H1 antihistaminic, it will be, double-edged sword. I mean, I will be having two benefit. It will block the H1 receptor in my brain. This drug will block H1 receptor in the brain. So person will have sedation. Okay, so during runny nose, I don't feel like working. I need rest. So I will take a H1 antihistaminic and I will feel sleepy. So here sedation is taken as an advantage, not as a side effect. Okay, but this drug will block my M3 receptor also. I'm having M3 receptors on the glands. M3 receptors on the glands increases nasal secretion. These are blocked, so my secretions will reduce. Okay, so it will be double. So I'm having H1 receptors in the brain and I'm having M3 receptors in the nose. Okay, H1 receptors produces wakefulness and M3 receptors produces secretion. Let's block them. Okay, let's give non-selective antihistaminic. They block this also, they block this also. So H1 receptor in the brain are blocked, person will have sleepy, sedation. And M3 receptors in the nose are blocked, person have decreased secretion. Okay, so if I'm having common cold, I will take a tablet of antihistaminic. So my secretions will reduce and I will take rest also. I will feel sleepy also. So here sedation is taken as an advantage because when the person is having common cold, person should take rest. So person is feeling sleepy, taking rest. Okay, because H1 receptors in the brain are blocked, I'm feeling sleepy. My M3 receptors in my nose glands are blocked and I'm having less secretion. Okay, so double advantage in the common cold. Okay, so in the brain, the first advantage was insomnia. During insomnia, we can give them. The second advantage to stimulate appetite. The person who don't feel hungry, appetite. Okay. The third advantage was motion sickness. Okay. The fourth advantage I told you is common cold. The fifth one I'm telling you. The fifth one is cough. During cough. What happens during cough? So again, the same story. Person have H1 receptors in the brain and in the cough, in the respiratory tract, person is having M3 receptors. And here both are blocked. H1 is also blocked. So person will have sedation and M3 is also blocked. So person have less secretion. Less secretion means less cough, less sputum, less cough. So here decreased secretion and sedation. So when I have cough, I want to sleep. Okay, I want to take rest. So this is due to take H1 receptors are blocked. I will feel sedation and my M3 receptors in my respiratory tract are blocked. So I will have less sputum, less cough. Both things will be solved. Okay, so that is in the cough we can use. Okay, so here this thing I have blocked here. And the next thing based on the brain is again the same, pre-anesthesia. What happens during anesthesia? During anesthesia, there is the anesthetist. Anesthetist, what the anesthetist do? Anesthetist do laryngoscopy. Laryngoscopy during anesthesia and put the tube so that during anesthesia person can respire. Yes or no? So for putting laryngoscope, the mouth should be clear and less saliva should be there. If the mouth is full of saliva, the laryngoscope, it will be trouble and the anesthetist cannot see it clearly and cannot put the tube clearly. So one day before the surgery, one day before the anesthesia, we want to reduce the saliva. We want to reduce all secretions in the body so that anesthesia can be smooth. During anesthesia, problem should not be there. So why don't we give antihistaminic one day before as a pre-anesthetic medicine? What it will do? It will again have the double-edged sword. So in the person, it will block the H1 receptor in the brain and M3 receptor in the salivary gland. Both are blocked. H1 receptor is blocked, person will feel sleepy. Okay, sedation. So we want sedation during surgery. And M3 is blocked, so person have less salivation. So we want less salivation during surgery. So reduce secretion and sedation, both purpose will be solved. Okay, again, promethazine is used here. How many of you are getting it? So we are utilizing this property again and again. Double-edged. Okay, got it? Secretion can get accumulated, Akshara. There are many type of cough. I will teach you that in respiratory pharmacology. If The cough, we do not want the secretion to irritate and cause the cough, we can use these drugs. But if the secretion is too much and we want to come it out, we will give another type of drugs. We will not give this. So cough is of many type. It is not the only one type of cough is there in which secretions are there and they will accumulate inside. It is not the thing. Okay. So sometimes the secretions irritate and the patient cough. That is the thing. Okay. So yes. So coming on the next, the last one based on the brain is Parkinsonism. What is Parkinsonism? I guess you know Parkinsonism is a disease in which dopamine and acetylcholine imbalance occur. So dopamine is less and acetylcholine is more. I guess everyone know. Normally dopamine and acetylcholine are balanced, equal and opposite in all healthy humans. But if dopamine is less and acetylcholine is more, it leads to imbalance and it leads to tremors in the Parkinsonism. So what is the main therapy of Parkinsonism? To increase dopamine. Somehow you increase dopamine, so balance is again there. So main therapy is levodopa. Levodopa will increase the dopamine. But along with that, give antihistaminic also. Here the main purpose is not blocking H. Antihistaminic will block the muscarinic receptor, producing anticholinergic effect and reduce the acetylcholine. So we are not increasing dopamine, we are reducing acetylcholine so that the balance should be there. How many of you got it? Huh? It was difficult. How many of you got it? So we are giving antihistaminic in Parkinsonism, which is causing anticholinergic action. So acetylcholine will reduce. Dopamine is already less. So again, it will restore the balance and the tremors can be treated. Got it? That is the action in Parkinsonism. That is the action in Parkinsonism. Got it? Yes or no? Okay. So that is the action in Parkinsonism. In Parkinsonism also, the M3 blockage will reduce the tremors by reducing the acetylcholine, and H1 blockage in the brain will produce the sedation. So Parkinsonism patient will have sedation. So again, double action is there. So these are the actions, the users. Okay, so these are the users. You can see the first one is based on allergy, anti-allergy. The second one is based on sensory nerve stimulation, that is itching. So the person is having itching, give antihistaminic, the itching will be subsided. The person having allergy, give antihistaminic, the allergy will be controlled. So anti-allergic action, anti-pruritis action. And based on the brain, there are 7 actions. The 7 actions on the brain are in insomnia, for appetite stimulation, for motion sickness, for common cold, for cough, for pre-anesthesia, for Parkinsonism. Out of all these actions, I guess these 5 actions involve H1 and M1 blockage both. In motion sickness, in common cold, in cough, in pre-anesthesia and Parkinsonism, we have blocked both. Here we have blocked only H1. Here we have blocked only H1. Only H1. So this also comes as a question in your exam. So which of the uses involve only antihistaminic action and which of the uses involve antihistaminic and antimuscarinic both action? Give me a thumbs up, people. Got it? Yes or no? Respond. So these are the uses of H1 antagonist. Now I will tell you the uses of H2, H3, H4 antagonist. Okay. So uses of H2 antagonist. Where is H2 present? You tell me. H2 is present on the stomach. Okay. On the stomach. H2 causes increased acid secretion. Block it. If H2 antagonist is given, the H2 receptors on the stomach get blocked on the parietal cell. So less acid secretion. So it is used as a treatment of peptic ulcer. So H2 antagonists are used in peptic ulcer. They are used in peptic ulcer. Coming on H3. Where H3 is used? H3 receptors are present in brain. Okay. And they reduce histamine. They are presynaptic. They reduce histamine. Histamine produces wakefulness. So H3 produces sedation. So they are used in narcolepsy. I hope you are getting it. People, they are used in narcolepsy. What is narcolepsy? Narcolepsy is a disease in which people sleep anytime, anywhere. Okay, we want this person to get wake. Okay, so I am giving H3 antagonist. What does H3 antagonist do? It is present presynaptically. So H3 antagonist, what it will do? It will reduce histamine. It will not, H3 antagonist will reduce histamine. Histamine produces wakefulness. H3 produces reduced histamine. So H3 antagonist will produce increased histamine. Increased histamine means wakefulness. So it can be given in narcolepsy. How many of you got it? So here H3 antagonist, that is pitolisant, is used. Okay. So these are the uses. The summary is in front of you. You can see the 9 uses here, 1 here, 1 here and 1 in H4. Okay. Of course, the antihistaminic is a very important topic for all university exams. Okay, so can you summarize the uses of antihistaminic? First, tell me the uses. 9 uses of H1 antihistaminic, 1 use of H2 antihistaminic, 1 for H3 and 1 for H4. So 9, 10, 11, 12. 12 uses I told you. All of them are marked in front of you. The first is antiallergic. The second is antipruritic. The third is sedation. I mean insomnia. In insomnia, it can be used. Insomnia. Okay, the next is motion sickness you can give. Next is to increase appetite you can give. The next is cough, common cold, Parkinsonism, motion sickness. These are the 9 uses here. Here we use it in peptic ulcer and here we use in narcolepsy. I'm sorry, not narcolepsy. Yes, this one we use in narcolepsy. That's it. How many of you got it, people? Anyone have any confusion? So we are done, complete, the uses of histamine antagonist, antihistaminic. Now the last thing is adverse effect. Okay, only 2 adverse effects. Sedation, most common adverse effect of first generation antihistaminic, most common because they can cross BBB. Okay, sedation is the most common side effect of the first generation. Okay, and the second side effect is based on anticholinergic properties. So the same, dry mouth, blurring of vision, urinary retention. So this is the summary of antihistaminic. Learn 9, 10, 11, 12. 12 uses and 2 side effect. All of them are marked in front of you. Count. They are 12 plus 2. You can see 12 red color and 2 blue color. And don't learn the numbers. Don't learn the uses. Don't learn these tables. No, you can see it here and understand each of them. So this is how we can understand. Anyone have any confusion? Want to ask anything? H4 uses again anti-allergy, Akshara. It will be because it is present on the immune cells, eosinophils and all. So it will be anti-immune and anti-allergy. It is under research. We don't much use H4 agonist as well as antagonist. In clinical practice, we don't use. Okay, so this is what you have to learn. Anyone have any confusion? So this is the uses and side effect we have learned. Okay, so you have to learn the main agonist at each receptor and main antagonist at each receptor. H1, H2, H3, H4 for your MCQs. So that is the thing. There are certain one-liners you have to learn for most of the drugs. This is only for MCQ. If you are preparing for university, you are lecture and here. But if you are preparing simultaneously for your competitive exam, NEET, PG, FMGE, INST, you should know the one-liners about these main drugs. Like terfenadine, which is a second generation, which is one of the second generation antihistaminic. It is the fastest acting among all of them. It is the fastest. Along with antihistaminic activity, it is having arrhythmogenic property. It is having arrhythmogenic property. This terfenadine is metabolized into fexofenadine inside the body. And because of this arrhythmogenic property, it is withdrawn nowadays. It is not used. These are your MCQs. Estimozole. This is the slowest and longest acting. This was the fastest acting. This is the slowest and longest acting. It also have arrhythmogenic property, similar to terfenadine. The next is acrivastine. These are all new second generation. Okay, this is the shortest acting. Okay, this is slowest acting. This is shortest acting. This is fastest acting. So fastest, slowest, shortest, these all are your MCQs. Okay, loratadine. Loratadine. It is metabolized to desloratadine inside the body. Okay, cetirizine. 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 Cetirizine metabolized to cetirizine is a metabolite of the first generation drug, that is hydroxyzine. Okay, that is the thing. And cetirizine have a little bit sedative effect, but levocetirizine is a L isomer of the cetirizine, which is having 0 sedative effect.
Hello everyone. I hope you found this concept clear and easy to understand. If you had liked to dive deeper into this topic and master it with full-length lectures, you can subscribe my app, that is MedLive by Dr. Priyanka. So, join me for the live sessions where we break down the complex topics in a way that makes them simple and high yield for exams. See you inside.